Hopefully you can understand that this particular video is in a memorial of these two doctors whom we have lost very recently, and we have lost them to the COVID, the recent pandemic that shook the world. For last 3 to 4 months, the world actually came to a standstill. We have lost the lives, and lost it have already started from China, Wuhan, and it have came to India. And right now, the cases are rising in alarming rate, and India is in fourth position. And these two doctors tried to save you from COVID-19, Dr. Vinod and Dr. Mithilesh. And recently we have lost them, alongside many other doctors and nurses who have served tremendously with a mask on, with PPE on, without PPE, without mask. They served in the ITUs and the COVID wards, and many of them have got infected. Many of them got the side effect of hydroxychloroquine very recently. And thing is that at this point of time we are not getting into lecture mode on COVID-19. But what is important, the public should realize the doctors are losing their lives, the policemen are losing their lives, and it is not a great feeling. It's not a great thing. It's painful to other doctors, and it's very demoralizing when any of the doctors are going to be ridiculed or threatened in their rental places. That has happened in Delhi and many others. So this should not happen. We really expect the administration should take due cognizance of every action and try to minimize any loss of temperament towards doctors. That is the very basic things that a doctor can expect and their family can expect. We are really saddened because they will not be back, and hopefully we will not forget their contribution because they inspire us. Many of the doctors have not given the recent Central Institute examination because they have served the COVID wards, and their contribution, they're continuing their work. They are pained that they have worked for the Central Institute examination but haven't been able to give that examination, and they have aired their grievances through the social media and through the TV channels also, and hopefully the authority and the administration will take note of it and make sure these young guns, the moral and the spirit of these young guns are not going to be lost. Now, another thing that has hurt the healthcare cost, and that is in one of the private healthcare. So we should understand the kind of contribution have been made by the government, and both state and the central government. And it's not only that 20 lakh crores or 2E14 amount by the central government. It's a tremendous effort given by the doctors and the other healthcare workers, the administration of the state governments together, that actually thwarted the progression of COVID-19 in India throughout the lockdown phases. At the last phase of the lockdown, during the unlock phase, we have seen the spurt of the cases. And once the spurt of the cases, when the public have lost their guard, actually the people with comorbidities got infected. So we can expect, and we are seeing, rise in the death rates. The crude death rates are rising, and that is alarming. Hopefully public is going to be alert, and at this point of time they will take all the due steps that is necessary to be taken, and hopefully they understand the contribution of the modern medicine doctors. They are actually saving your lives, and without pointing finger, and this is not the right time to pointing fingers towards anybody or any community or anything, but at this point of time it should be a unified effort to thwart this particular virus. And once we do that, then after we can do the post-mortem of the situation and find out the loopholes and correct them. But at this point of time, the focus should be staying united and thwarting this particular virus and supporting all the young people, and little bit seniors also, who are working day and night through their work, through their patient care, through their online and offline uploads. They are trying to help you. They are trying to raise the awareness through their national and international publications. They are trying to contribute to in this fight as a positive catalyst. Hopefully, as a common public, general public, you should realize this contribution and don't forget the lives that have been lost. This is important that you remember these two young people who have lost their lives, and many others, few senior doctors have lost their lives, and also the sisters and the other healthcare workers have also got infected and lost their lives. So though the mortality rate is not as alarming like rabies, yet considering the population India have, the total death is already gone up to over 3 lakhs, and that put India, the total cases in 3 lakhs, and the total deaths are going to go up very fast. So that is actually putting India in a very precarious position, and everybody is concerned. You should also be concerned, and not only concerned, you should be aware, responsible, and take due steps to thwart the progression of this virus. Thank you.